So the tumor microenvironment is a really important player in the pathogenesis, development, progression, and relapse in follicular lymphoma. And it's mainly composed of lymphocytes and macrophages. So one of the ways of assessing the composition of the tumor microenvironment is actually to look at the lymphocytes in the peripheral blood and the monocytes in the peripheral blood. And so the lymphocyte-to-monocyte ratio has been proposed as a easy and accessible way to evaluate the tumor microenvironment in follicular lymphoma. So what we did in a retrospective study a couple of years ago was to evaluate whether the lymphocyte-to-monocyte ratio had an impact on survival in follicular lymphoma, and we found that patients with a low lymphocyte-to-monocyte ratio actually had higher tumor burden features and also poorer survival. And we then tried to validate these findings in a cohort from the RELEVANCE trial, which is a randomized controlled trial evaluating rituximab chemotherapy versus rituximab lenalidomide in previously untreated high tumor burden follicular lymphoma patients. So we selected 1,018 patients from the RELEVANCE trial who had available data on the lymphocyte-to-monocyte ratio and established the best cutoff to predict survival, PFS, and it was a cutoff of 2. And so we stratified patients according to this cutoff and compared baseline features and survival, and the findings were pretty consistent with what we had found in our previous series, with patients with a low lymphocyte-to-monocyte ratio exhibiting higher tumor burden features, higher risk of early relapse or POD24, and also shorter progression-free survival and shorter overall survival. We then analyzed whether this impact of the lymphocyte-to-monocyte ratio had anything to do with the treatment arm. In other words, if the impact of the lymphocyte-to-monocyte ratio was different in the R-chemo and the R-lenalidomide arms. And indeed, it was different. Specifically, we found that the impact was maintained in the R-chemo arm, but not in the R-lenalidomide arm. And that is a very, I think, important piece of information concerning the impact of prognostic biomarkers in relationship with the treatment that patients receive, especially with lenalidomide, which is an immune modulator.